أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and is your guidance that we seek. Ya Allah, keep us in the straight path. Ya Allah, show us the choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations in our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. Assalamu alaikum wa rahmatullahi wa barakatuh and welcome to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal MJ Sulaiman. We welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming on Facebook, on YouTube and other platforms. Our topic for discussion this evening is anxiety and depression, and our very special guest is Dr. Zubair Mullah. But before we talk to Dr. Zubair Mullah on anxiety and depression, we're going to be speaking to Dr. Faisal Sulaiman, who's going to be talking to us about the convention that's going to be held in Cape Town on the 8th and 9th of August and the 10th and 11th of August. And this is the Islamic Medical Association of South Africa's convention, as well as the Federation of Islamic Medical Associations convention. Dr. Faisal Sulaiman, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me on the program this evening.
Wa alaikum salam wa barakatuh, Mr. Faisal Sulaiman. Thank you for having me.
Okay, I'm talking to you tonight as the chairperson of the Islamic Medical Association of South Africa and not SAMNET, so we just need to be on that on the right lane there, right? Because I think I'm always talking to you, on behalf of SAMNET. So tonight, let's concentrate on Islamic Medical Association of South Africa. Now, Faisal, there are two conventions that are going to be taking place in Cape Town. The FEMA convention and the IMA convention. For the first is on the 8th and 9th of August. The second is on the 10th and 11th of August. Tell us about these two conventions.
All right. So, yes, Jazakallah. So, the IMSA is part of the Federation of Islamic Medical Associations. We've got about 42 member countries and a few associate members. And, this is a networking opportunity. We do a lot of, there's a lot of charity activities, surgical stuff. There are a lot of, in Africa, cataracts, cleft palate, and a whole host of work that gets done through FEMA and by FEMA itself, Al-Khidmat, etc. So there's an annual council meeting of all the FEMA members. And this year, it's after 13 years, South Africa's turn to host it. So on the 8th and 9th, this is all at the Lord Charles in Somerset. We host all of the member countries in a 2-day council meeting. Mm-hmm. Thereafter starts the 42nd Annual Islamic Medical Association Family Convention. So there's a little bit of background for this. So the family conventions, as I said, is our 42nd. Mm-hmm. They rotate between Durban, Johannesburg, and Cape Town. This year is Cape Town's turn, so they got the pleasure, but also the hard work of hosting the FEMA council meetings as well. And of course, this year, a lot of the international delegates or guests come as both speakers and as delegates to the convention as well. So many of our speakers this year come from, experts in their field from all over the world. The FEMA the IMA conventions itself are slightly unique in the sense that, generally you've had like Zubair would go to a psychiatric congress or a convention, and it would be psychiatrists, etc. So the IMA one is, so we have a full medical for those are for the doctors, mm-hmm. Dental sessions, optometry sessions, and in between allied health. There's a combination of I suppose cutting edge talks on clinical medicine, but also a large component on fiqh, on Sharia, on ethics. Zubair himself, Dr. Mullah, has spoken at our conventions in the past, has presented papers. So, they're a combination. And then we have a full student program. We subsidize quite a few students to go to the conventions wherever they are, local and national, because these are where they get to meet, mentor, bring up their issues. And of course, this is our leadership program for the future. Mm-hmm. And we also have a program for the spouses, for the children, for the teenagers. So essentially people come as a lot of the delegates come with their families. And so that there's something for everybody. And of course, it's also networking, it's camaraderie. It's just 42 years. A lot of the people are meeting once a year, colleagues from med school days. So it becomes quite a nice social. This year we also host Naledi Pendo as one of our featured guests. So alhamdulillah, it's and I think the appeal to make now to everybody, especially in the Western Cape, is that we'd really like to see people attend as day delegates. And if you can't come and check in the hotel for the 2 days, then come in as a day delegate. And of course, for those outside of Cape Town, it'd really be wonderful if you show your support and come in. And then of course there's also the exhibitions. So all of this needs a lot of money, and one of the ways of recouping costs, and of course getting to see the latest drugs, etc., is also to have exhibitions by the pharmaceutical companies, people doing health products, obviously the financial companies, Sharia unit trust banks, etc., will have stands. So that helps to offset some of the costs, but also at the same time give opportunity for marketing and interaction between all of the health professionals.
Excellent.
And yeah.
And Faisal, is this open to the public or is it restricted to healthcare professionals?
So no, if you register for the convention and you pay the fees, there's no restriction on who can attend. Some of the lectures would be very specific to medical professionals, those that specifically along the lines of clinical medicine, but there are quite a few, and I imagine some of the dental ones and optometry ones would be quite specific as well. But within the medical program, the larger sessions, there's quite a bit about ethics, about healthy, because this year's theme is healthy families, healthy communities. So there's a lot about that as well. So yes, if you were prepared to pay the registration fee as a day delegate and attend, you'd be most welcome.
And registration, if one wants to register, how do they register?
So easiest is the IMA website, imasa.org.za. Everything is there, the fees, the methods to pay, the program is out there, you can pick and choose. So yeah, it's pretty easy off the IMA website. And of course, if you want to do it the old-fashioned way, you can contact the IMA office, any of the offices nationally, but Cape Town and Durban are handling most of it. So that you'd easily find off the IMA website as well, and you can call. It's an opportunity, as I said, to meet and also this year to hear from our international guests as well.
Sounds very, very exciting, Faisal. The other question is there going to be any media coverage, live media coverage of the event?
So we are at the moment in talks with one of our two TVs, the Muslim TV stations. We've invited the general press, especially for the gala dinners where Naledi Pendo, the president of FEMA, will be, and myself as the IMA president will be delivering talks. So we've invited national press, but of course we're hoping that our Muslim radio stations, especially those based in the Cape, Voice of the Cape and Radio 786 in particular, will send people out, to cover it as well.
Inshallah. Faisal, I want to thank you for joining me on the program this evening, but I'm sure you have a message for our listeners.
Yes, please come. If you have a health professional in the family who's not listening and they may not be aware of it, really, we'd appreciate your attendance. It's also, like I said, it's cutting edge stuff. And of course, we don't mention it because it's not a big deal. There are many ways to get CPD points, but for all of the health professionals, obviously, most of the talks are CPD accredited, so you're going to get your annual quota of CPD points, both ethics and clinical points for attending, and that is also obviously a bonus as well.
Absolutely.
But it's also support because the eventual profits, where there are any, I imagine this year we're hosting FEMA, there's not going to be much of a profit because the hosting is at our cost for all the international delegates. But where there are profits, these go back into all of the projects, that we run, the renal dialysis, the frail care, all the clinics. So either way, it's a business write-off. It's a taxable expense, but at the same time, it's showing support. And hopefully, inshallah, we get new people to take over from us as well.
Inshallah. Faisal, I wish wish the Islamic Medical Association all the best and wish you success. And inshallah, we will talk to you again on our future programs on the event, inshallah.
Yes, and inshallah, what we'd like to do, Faisal, is maybe as our international guests arrive, and some of it is even available on Zoom. We have, for example, a plastic surgeon from United Kingdom who's highly knowledgeable, very passionate about the history of Islamic medicine or medicine in Islam, in the golden age of Islam, and he'll be delivering a talk as well. And he's always keen to come on radio and share his knowledge, for example. So there are many like that. Professor, Nurdin is a neonatologist professor from Malaysia, extremely passionate about Palestine, etc., and they do a lot of work there. So we have people like this who will be not only delivering talks but also available to share their knowledge, on the radio as well.
We will take advantage, and of course, I'll keep in touch with inshallah to for the necessary logistics. Faisal, thank you very much for joining me on the program, and Assalamu alaikum wa rahmatullahi wa barakatuh to you.
Wa alaikum salam, and thank you for the opportunity.
Most welcome. We spoke to Dr. Faisal Suleiman, the chairperson of the Islamic Medical Association of South Africa, and he spoke to us about the convention that's going to be taking place, inshallah ta'ala, on the 8th and the 9th and the 10th and 11th of August. Then that's going to be taking place in Cape Town. But right now, we need to talk about anxiety and depression. And I say Assalamu alaikum wa rahmatullahi wa barakatuh to our studio guest, Dr. Zubair Mullah.
Wa alaikum salam wa rahmatullahi wa barakatuh. Shukran for having me today.
Thank you so much for joining me in the studio. Dr. Mullah, just to introduce him, has completed his undergraduate medical degree at UKZN and postgraduate studies in the UK. He says MRC Psych, and also holds a FC Psych. Why you guys use this fancy terminology?
No idea.
This is the Fellowship of Psychiatrists, is it?
That's right.
Okay, he holds a Fellowship of Psychiatrists from the College of Medicine, South Africa. He's a seasoned expert in the field of psychiatry with several years of experience behind him. He trained in the UK and gained experience in all aspects of psychiatry. He has been in private practice in South Africa since 2011 and advocates a holistic approach to dealing with mental health problems, and is a general psychiatrist and deals with all aspects of mental health, including general adult psychiatry, child and adolescent psychiatry, psychiatry of old age, substance abuse, and eating disorders. Dr. Mullah, in fact, I say thank you for joining me. Our topic is depression and anxiety, but let's just start with depression. What is depression and what are symptoms of depression?
So that's an important question because, first of all, to have a problem, whether it's a physical health problem or a mental health problem, you've got to have three things. I think three things have to be there at the same time. One is that you've got to have symptoms. I'll explain what I mean now. Yeah. They have to have been there for a while, and the third and most important thing is that they need to impact on your functioning. So if you look at depression, when you have these three clusters of these aspects which come together. So the first thing is symptoms. You don't have to have all of the symptoms, but when you see that there's an aggregation of these symptoms which include low mood, irritable mood, sometimes even anxious mood as well, sometimes emotionally numb mood as well, which is then associated with changes in sleep, usually poor sleep where you have insomnia, but you can also have increased sleep, hypersomnia. Same with changes in appetite as well. You can have a decreased appetite. Usually that is the case. Decreased appetite, but sometimes you can even have an increased appetite. You can have loss of weight. Sometimes with depression, it's such a bad illness as well, that apart from everything else, that you might lose appetite, but you might gain weight. Then there's problems in terms of concentration, not just concentration, but also in terms of what we call executive functioning, planning, organizing, that sort of thing. There's a lack of motivation. You don't enjoy things that you used to do. You don't do things you used to do. You find even the basic things become quite difficult. You might have inappropriate guilt ideas where you feel inappropriately guilty about things you haven't done or things you have done, but there's a disproportionate guilt to that. You might have suicidal ideation as well, thinking about what's the point of life. Maybe not active suicidal ideation, but more like along the lines of, if I just had to go now peacefully in my sleep, I wouldn't mind. So if you have these kind of feelings that have been, these kind of symptoms, that have been there, we say usually needs to be there for 2 weeks, but really by the time a person realizes that he or she is depressed, it can actually be weeks or months, and by the time they actually seek help, can also be a few weeks or months, because they don't realize what's happening to them. So if you have these symptoms which have been there for a while, but more importantly as well, impacting on your functioning. Functioning means your entire life, basically your outlook in terms of life, your interaction with your spouse, family, friends, socializing, work. Islamically as well, you might find things are lagging, that you're not enjoying things, you're not doing things as much as you used to. So when you have a cluster of these three aspects coming together, then you will say that the person is depressed.
We use the term depression very loosely. I mean, I'm depressed, but we don't really understand what is depression. Now, you use the term anxious moments. I take it that's linked to anxiety?
Yeah.
And what's the difference between anxiety and depression?
So depression is, like I said, if we're talking about clinical depression now, not the kind of colloquial term used, but in terms of terms of clinical depression, you've got the symptoms I mentioned that I said have been there for a while, that impact on your functioning. With anxiety, it's similar in terms of that you've got symptoms that again have been there for a certain amount of time, and again impact on your functioning. So with anxiety, really, anxiety is a topic on its own. In fact, some aspects of anxiety will be topics on their own. But really, if we just focus on the main kinds of anxiety, which are really generalized anxiety and panic attacks. So this is where you have excessive worry. You're worrying about things that you either should be worried about, but you're worrying about it excessively, or you're worrying about things that you don't have to worry about. And these then impact in terms of your functioning and can lead to insomnia, etc. So with the generalized anxiety, it needs to have been there for a while. We usually say 6 months, but really it's been there for much longer. Usually you have associated tension, muscle tension, you have poor energy levels, irritability, that sort of thing as well. You have a low tolerance in terms of people, but also in terms of sounds, sights, etc. You can't take loud noises, that sort of thing. An important thing to note is that very often depression and anxiety coexist. So if you think about it, if you are depressed and you can't do things you used to do before, things that used to be quite easy to do before become a huge struggle, you're going to be anxious doing things that you used to do before. So that's where the anxiety may come from. With anxiety as well, it could be that you are not doing things you used to do. You get social anxiety, you get generalized anxiety, so you're not able to function. You find things again much more difficult, and you get very worked up. You can get panic attacks, which we'll talk about now. So this can lead to a secondary depression. So we always try to work out what's the primary problem. Is it a primary depressive problem, or is it a primary anxiety problem?
Our topic for discussion on Medical Files is anxiety and depression, and our special guest is Dr. Zubair Mullah, a psychiatrist practicing in Durban. And if you have any questions, you may forward them to us via WhatsApp on 060-904-1056. Just to place on record, the doctors and guests that appear on Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, allergies, etc. Neither the doctors, nor the relevant radio station, nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Just to repeat, if you have any questions on anxiety and depression, you may forward them to us via WhatsApp on 060-904-1056. Now, many times one experiences general sadness, and one also mistakes general sadness for depression. Now, what is the difference between general sadness and depression?
Yeah, that's an important question, because I think we have to get a balance. There's been a big debate in the US, for example, for a few years now in psychiatry, whether we are over medicalizing things that should be normal.
Yeah.
So really, once again, it goes down to it goes down to, do we have those three aspects in place? Do we have symptoms that have been there for a while? Because everyone's allowed to be a bit down now and then. It's life. Life is up and down. The most important thing in life is, not what happens to you that's out of your control, but how you respond to it. So if we look at sadness, with sadness you will feel down, and it's an appropriate feeling. Something has happened. It could be a huge life stressor, for example, loss of a job. It could be a bereavement in the family, someone you know, and you are going to feel sad. And it's very important not to treat sadness, because sadness has a role. Pain and joy are two sides of the same coin. If you don't experience one, you won't experience the other.
Yeah.
And of course, from an Islamic point of view, this is where we learn sabr and things. I think that's quite important. But if you talk about depression, you're talking about a different beast, really.
Mm-hmm.
You're talking about where you've got symptoms that impact on your functioning, like I've said before, which makes it difficult to be able to solve your problems. Very often with depression, you will have a problem that has caused or exacerbated the depression, but it's not as simple as saying, pull up your socks or that sort of thing. So I think we have to distinguish between the two. The one we don't treat, or you might need a bit of counseling in terms of coping techniques. A sudden death in the family, for example, that's absolutely fine. You don't need medication in those cases. But where there's a clear impact on your functioning, now you've got two problems. You've got the problem that made you depressed in the first place, whatever it might be, and you're now not functioning well. So you're not interacting well with your family. Work suffers. You might be at risk of losing your a job. You're not able to bond with your children, for example. Mm-hmm. So there's lots of reasons that you need to treat the depression in those cases with medication, which then helps with your symptoms, which allows you to then deal with the problems that made you depressed in the first place.
Mm-hmm. Okay, we've got a minute to the ad break. I'm going to pose a question that's come through, and then we'll deal with this after the ad break, right? The question is, Assalamu alaikum wa rahmatullahi wa barakatuh. Really grateful to you for discussing such an important topic, difficult topic. And my question is there a difference between panic attacks and anxiety attacks? And what are the different ways in which they present themselves? So you got them? Is there a difference? And okay. We'll take an ad break, and on the other side, we'll continue with the program, inshallah.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a Day. Eat with the right hand and accept gifts with the right hand.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
At Amina's Wonder Spice, we know that many of you already enjoy the pleasure of cooking with our 100% pure ginger and garlic. Our unique masala paste have created a new dimension and variety to your dishes. For all these reasons and more, we've called it a Wonder Spice. Amina's Wonder Spice, creating a unique taste in a paste. Available throughout South Africa, neighboring countries, and also in the UK. Contact us on 031 577 5023 or www.aminaspice.co.za.
The International Sacred Trust's exhibition once again comes to South Africa, showcasing the various sacred relics of the Nabi sallallahu alayhi wasallam and the Sahaba radiallahu anhu ajma'in, starting at the Al Ansar Hall on the 27th and 28th of July from 10 a.m. to to 9 p.m. Other venues include Chatsworth, Phoenix, Tongaat, Ladysmith, Newcastle, La Lucia, and Pietermaritzburg. Please watch social media platforms for more information. This is brought to you by the Syed Ehraz Foundation in association with the Chisti Sabri Jahangiri Khanka and Research Center. Contact 071-896-0148 for further information.
You've asked and we've listened. The Sultan Bahu Family Fete is here again. Help us heal hearts by joining us at the Old Durban Drive-In from the 8th to the 11th of August, 10 a.m. to midnight for loads of fun, food, shopping, a grand fun fair, comedy, kavali and giveaways. For stall inquiries, call Tasneem on 081-836-2888. That's 081-836-2888. The Sultan Bahu Family Fete. A fate with a purpose. Sultan Bahu is a registered NPO and PBO.
The Al Ansar Foundation. Dawah, Tarbiyah and Education, establishing the foundations of Islamic civilization in South Africa.
You're listening to Medical Files on Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. Our topic for discussion is anxiety and depression, and our special guest is Dr. Zubair Mullah, a psychiatrist practicing in Musgrave, Durban. And of course, this is an interactive program, so you can forward to us any questions that you might have on anxiety and depression on 060-904-1056. Dr. Mullah, the first question that came through was Assalamu alaikum wa rahmatullahi wa barakatuh. Really grateful to you for all discussing such an important, difficult topic. My question is there a difference between panic attacks and anxiety attacks, and what are the different ways in which they present themselves?
Shukran. So first of all, to say that panic attacks are anxiety attack is a kind of layman's way of saying panic attack. So there is no such thing clinically as saying anxiety attacks. So we talk about panic attacks, but then to explain to the patients, sometimes we would use the words interchangeably, anxiety attack and a panic attack. So basically it's the same thing. Mm-hmm. But if you look at panic attacks, we spoke earlier about generalized anxiety. Generalized anxiety meaning that the anxiety is there with you almost all the time in some form. Sometimes it's more, sometimes it's less. It's not really due to any external stress. It might be exacerbated by some things. Something is going on the next day, so you worry about it a bit more. But even at the best of times, you still are worried about it. Panic attacks can exist on their own, or they can be in association with a generalized anxiety. So you can have someone with a generalized anxiety who then gets a panic attack, or you can get a panic attack just out of the blue. So a panic attack, I'll first describe some of the symptoms, and it's quite easy to work out once you know what causes a panic attack. So if you look at a panic attack, you can have the most common symptoms are a sudden onset. That's important. It's not something which is gradual over the course of the day. It happens within a few minutes, lasts usually about 10 to 15 minutes, and it's characterized usually by palpitations, your heart beating fast, and awareness of your heart beating, hyperventilation, breathing too fast, gabrat, you can say, kind of thing, just to use a medical term, I mean. Then you can get popular medical term. Then you can have other things such as dry mouth, sweating, cold, clammy skin exteriors. You can get butterflies in the stomach that we speak about, basically abdominal cramps. Mm-hmm. You can also get cramps in your legs, etc. Headaches, feeling very, very hot. So the question is, what is happening? So first of all, really, if you had to explain this, it's simply put that one part of your brain, the subconscious part of the brain, is fooling the conscious part of the brain into thinking there's some kind of danger, right? So your brain, which loves you, because that's you, basically says we've got to do something. We've got to run, or we've got to fight. So basically, we have to fight or flight. And what the brain does is that it releases chemicals in that acute stage, adrenaline, noradrenaline. And simply what they do is the fastest way to be able to get ready for a fight or to run is to redistribute blood from the so-called non-vital organs to the vital organs. So what the adrenaline and the noradrenaline does is to say, look, we don't need blood on on our skin at that stage. You don't need to look lovely and flushed when you're about to die, for example. So it takes blood away from that. But actually, there is no danger. You're sitting at your desk, or you're in front of a crowd, speaking, for example, and you get a panic attack. So suddenly you feel cold, clammy, sweaty. Then there's increased blood to the heart because your brain now thinks that you're going to be running, but actually you're not going to be running, or you're not going to be fighting, because when you do run, then your heart beats fast. That's just normal. But imagine there you're sitting at your desk, or you're in front of an examiner or something like that, in front of your boss, and you have a panic attack and your heart's beating fast. You start to breathe fast as if you would normally do when you're running. And then with the entire gastrointestinal tract, there's no need to be digesting food again when you're about to die, so to speak. So there's a decreased blood flow there. And similarly with every other organ in the body, you get a headache because there's increased blood flow to the brain, but there's no need to think your way out of this danger, because there is no danger. So if you can just imagine that, it makes a big difference, because a panic attack is a terrible feeling, a feeling of losing control, a feeling of embarrassing yourself, a feeling that there's no escape. If you need to escape, there's no need to escape. But if you understand that it's just to do with the blood flow, then simple things like slowing down your breathing apart from everything else, sends a signal to the brain that there is no danger, and then all of that will decrease slowly. But you need to be able to control these things when you're not anxious. You need to practice on these things. Absolutely. So many times the non-medication part does help a lot as well.
Another question that comes is, Salams, Jazakallah for the topic. Not many of us realize we have an issue. Just heard Doc speaking of noise tolerance. Of recent, I cannot handle noise, kids screaming, lots of people talking and banging. Where does one start to get help?
So as always, it's important. We're speaking about depression, we're speaking about anxiety. One important thing is that you always have to make sure that there isn't any physical cause for it. I tell my patients, if the very first time that you get chest pain and you think, oh, no, this is an anxiety attack, what if it's a heart attack? Exactly. So you got to look at things in context. So I think similar with this, it sounds like it could be anxiety, but I would first want to know are there any problems in terms of hearing? Are there any other causes for this? Sometimes you need to make sure that you're not hyper vigilant because of a thyroid problem, for example. So I don't think that's the case in this case. But really, what we're saying is that that the hypersensitivity to sights and sound is very, very common with anxiety. Very, very common. It can exist in other conditions as well. For example, with autism and other things as well, but it's very common with anxiety. So what do you do about it? If you see it as a symptom, because you can't change your environment, you can't, you need to be very clear that there's a problem with that the symptom is the problem. It's not a problem with that child who's laughing, or someone else doing something else. So the main thing is treat it, find out if there's any other symptoms, how long they've been there, and then if you need appropriate medication, we do have good safe medication to use these days. But your mindset, your outlook, the way that you analyze things is very important as well. Because really what we're saying is that like that glass that's almost full with your thoughts, with negative thoughts, with thinking about things too much, all it takes is a little bit just to push you off the edge. So I would say, either have the glass less full or get a few glasses.
Yeah. Okay. Another question says, Salams, is 200 milligrams Deglanol, 60 milligrams of Simgen, and 1 milligram Risperdal good enough to treat depression and mood swings for a young adult under 25 years old? Jazakallah. Or is the injection a better option in terms of treatment and side effects?
So I think this is a bit out of what we're discussing today, just, based on the medication. One of the medications there was an antidepressant. The other medication can be used for many things, including anxiety, but not on its own. And then when the person speaks about an injection, we normally are talking about other conditions, probably some kind of psychotic, long-term psychotic illness, to use a clinical term, sometimes in terms of in terms of bipolar mood disorder, usually type 1. So it's something that I think is not it'll be difficult to answer in this context. Just to answer generally, I think this is a difficult question. Best to speak to your a doctor about this, and they would need to look at the history. They would need to look at many other things as well to see what's the best option. Both are good options.
Assalamu alaikum. Would like to remain anonymous, please. I have a lot of these symptoms related to depression and anxiety for a while now. I've had the anxiety attacks as well. What can be done? I've taken Urbanol, but it's made me restless.
Gee. So again, I suppose this is a good time to touch on the treatment. So if you look at the mental health condition, it's clearly like a physical health condition, but it's also unlike a physical health condition. So the first thing is that I always say that there's four things that are important. A four-pronged approach. All four are important, not either one. One is medication.
Mm-hmm.
If you look at medication is quite important, but it's only one part of the treatment. So looking at anxiety, really we use two kinds of medication if you think about it in the whole of medicine. One is your symptomatic medication. You've got a problem, you've got a headache which is caused by some clear problem in the brain or something. Maybe it's a tumor of some sort. So the first thing is symptomatic medication, and this is where the Urbanol, for example, comes into play. It's something that helps with anxiety. It's not the only one. It helps initially. It helps in the short term. It's something not to be used long term, and this is something else that we need to mention is that you need to be very, very careful with the addictive medications. They have a definite role, sleeping tablets, benzodiazepines, but they need to be used cautiously and only in the first few weeks and intermittently after that as well. So if you look at the medication, we use antidepressants, and that's an incorrect name. Much of the names of the medication need to be changed, because the antidepressants treat anxiety as well, and almost as frequently we need to use it for anxiety and for other, for most kinds of anxiety, and it's used for other conditions as well. So I think first of all is an antidepressant. You need to take a history, make sure the person doesn't have any significant medical conditions. Maybe you need to do some blood tests first as well. But the medication that's used for depression is also the one used for anxiety, except that you need to start off usually with a low dose, and it might take a bit longer for it to work. So in that time is where you might use your Urbanols, benzodiazepines, not that only. There are other groups of medication that can be used that can assist the antidepressant. So sometimes we find that it doesn't work that well, or it takes a long time to work. Then we do add on short-term medications that are not like the Urbanols, the addictive medications, but also take a few days to work. But with the combination of the medication, usually things do improve. But in the longer term, really, we want you to be on the least amount of medication for the shortest amount of time, assuming there's no side effects as well. Mm-hmm. There are a few other treatments we can discuss in a few minutes.
I like you say in a few minutes. We have very limited. Okay. I've got a minute for the ad break, but the question that came in is, Assalamu alaikum. Jazakallah for informative topic. What are the dangers of leaving depression untreated? And comes from Anonymous. Jazakallah. Will you be able to answer it in a minute, or shall I take the break and then you'll answer it?
Take a break first.
Take a break. Okay, Zach, can you take that break, please?
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031-306-4029 or Kenilworth Park, 202 Brickville Road, Overport. Simplex Radio, the name you can trust.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031-208-9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Would you like to give Sadaqah 365 days a year? You can with the Al Imdad Foundation's Daily Sadaqah program. Donate as little as R1 a day for a month for each member of your family, up to any specified amount, and receive monthly feedback on where your contributions have made a difference. Visit alimdad.com and download your Daily Sadaqah debit order form, or call 0861 786 243 for more information.
The Watch Doctor. for watch repairs, watch batteries, watch straps, 21st keys, engraving, and sound for your occasion. Handled professionally at 263 Sparks Road, Mohammedia Center, Suite 104, Overport, next to the Sparks Road Masjid. Contact Zain on 082 542 3070. The Watch Doctor. The Watch Doctor. Keeping time every time.
The Al Ansar Foundation, Dawah, Tarbiyah and Education, establishing the foundations of Islamic civilization in South Africa.
You listen to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. Our topic for discussion is anxiety and depression, and our special guest is Dr. Zubair Mullah, a psychiatrist practicing in Musgrave, Durban. Dr. Mullah, question that comes through is, Assalamu alaikum, Jazakallah for an informative topic. What are the dangers of leaving depression untreated?
Gee, so this is an important question. I think the first thing to point out is that you don't always need to have a medication to use medication to be able to overcome depression, but a significant part of the time you do. It all depends on the severity of the depression, how it's impacting on life. What happens if you leave it untreated? So first of all, it's going to continue to impact on your functioning, like we said earlier, and these are significant problems. You're looking at an impact in terms of family life, children, spouse. You're looking at impact in terms of finances. You lack the motivation to even get out of bed, leave alone go to work. So you're at risk in terms of your job, business, and left untreated further down the line, it can lead to other things. It can lead to, first of all, comorbid condition. So a comorbid condition means that you'll have the primary depressive episode, but you'll have other coexisting conditions that make things worse. Anxiety being one of them. Sometimes even people turn to substances of all kinds, legal, illegal substances, to be able, as a form of what we say, self-medication, where you try to then use something to help you sleep. You might take something to help you with the depression, or you think is helping you with the depression, or just to numb you, basically. And now you end up with another problem as well. Then you can also have obviously a suicidal ideation, which can easily become worse. First of all, there's something which made you depressed. Now it's impacting in terms of your functioning. It's impacting in terms of your life. It's impacting in terms of self-esteem. It's impacting in terms of suicidal thoughts and the way that you analyze things as well. So left untreated, it's very, very serious. And I think that's important, that we first need to, like you said earlier, we have to distinguish between sadness and depression. And then we need to get help as soon as possible. Not just medication, but counseling, getting back into life. Sometimes seeing an occupational therapist is so helpful as well. Getting back into routine, getting back into life. How do you cope with things? And of course, you've got to try and solve your problem as best as you can, whatever it might be.
Okay, Salam Doc, is Ivadol good for sleeping and any side effects?
So Ivadol is one of the sleeping tablets, and you get essentially about 3 or 4 sleeping tablets. Now you must remember that all of the sleeping tablets, I should actually be careful, because there's a new one which has just been released in South Africa, but all of the traditional sleeping tablets are addictive without exception, and they are all variants usually of benzodiazepines, which are addictive as well. They do have a role. They do have a short-term role. As soon as your sleep improves, that helps with your mood, with your depression, energy levels. So very often I would prescribe it, but not long-term. Ivadol is zolpidem, which is one of the common sleeping tablets. It's a means to an end. It's a means to sleeping until the antidepressant, which takes a few weeks to work, until it starts to work, until you've started to deal with your problems. It's a good option, but has to be short term. Otherwise, you end up with another problem.
Any side effects?
Side effects, sleeping is a good side effect, sometimes oversleeping, but that's rare, because because the half-life and the way that it's made such that it should work almost immediately, and usually lasts about 6 to 8 hours. But it's important that you do take it as the last thing you do before you go to sleep. If you take it earlier than that, sometimes people are half asleep and they start to do strange things. They might go and eat again, or they might call someone. Some people call that exes and stuff,
Yes,
and you
yes.
don't remember it.
Is it?
Also,
Yeah.
also there's increasing evidence that the use of benzodiazepines, which Ividil is one of them, it can be I think I need to say this very carefully, can be associated with dementia later on in life. Although there's many other risk factors. We're talking about long-term use, not just intermittent use.
Okay, the questions are pouring in. I hope that we're going to be able to manage them in the
We'll
few minutes we
have
got
to
left.
stay for another hour probably.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Saheb, what is your experience of depression and anxiety in Parkinson's disease?
Okay, so Parkinson's is interesting because you can get depression that is associated with Parkinson's in a few ways. Parkinson's disease is a neurological condition where you have including tremor of the hand, rigidity. You are slowed down in terms of your movements, in terms of your thoughts, in terms of your speech. So first of all, in the early stages, because in the late stages you can get dementia, you might not be aware of what's happening, but in the early stages, when you know that there's a change in you, you might then find that you are becoming depressed because you are aware that there's been a change from how you were before. Then, in terms of the medication that's used with Parkinson's, that's not a problem usually, because most of the medications are actually one of the side effects of these medications is that they increase your motivation. So it's a good side effect. You have to be careful. Some of them can be addictive as well, but generally it's more in terms of either that there's an associated depression with the Parkinson's, or it's a secondary depression where you can have a problem with depression because you're aware of the change. Later on, with dementia, which can occur with Parkinson's but occurs late, usually you can then have a kind of depression where you seem to be depressed, but it's actually part of the dementia. It's not really depression.
Okay, I've got a very interesting question here. Salams. How does a psychologist assist a person who has Alzheimer's for depression and anxiety, since they don't know what's happening? Will you only use meds?
So this is a good question again. I think there's some conditions that we use. Like I said earlier, we use a combination of medication and non-medication. With Alzheimer's dementia, especially in the late stages, and unfortunately, it's something that we don't pick up early. It's hard to distinguish between normal aging and dementia. But if it's in the late stages or the later stages, then really the main treatment is medication. If it's the early stages, like earlier with the Parkinson's, is where you're aware that there is a change. Then you might become depressed. You might become suicidal because especially if you've been high functioning before, that it's a downhill trajectory. Then there might be a problem. Psychologists can't then do your basic CBT, cognitive behavioral therapy. What are you thinking? What's the evidence for for and against. You can't do those kind of thing with someone with Alzheimer's dementia, but they can do other kinds of treatment. They can do kind of memory training. They can actually take them back to the old days. They can try and remind them who they are, that sort of thing. They can give them techniques in terms of learning. But the person is right. A psychologist would not be the mainstay. One thing that a psychologist, I have to say, is very important when it comes to dementia is making the diagnosis if it's not clear. You need to do specific neuropsychological testing that can be helpful.
Okay. For years, I struggled with social anxiety. Now it's getting worse, making me depressed. How do I sort it out?
So once again, you have to get to the bottom of it. Whilst I've said earlier that's important that you do challenge your thoughts, inappropriate negative thoughts, you do go out there and face things. It's difficult to do when you have severe anxiety without medication. So we use again short-term medication, just to either you can use it every day initially, or you can use it when you are going to do something. So the idea is that you take the medication, it calms you down, but you don't just chill at home. You go out and you face your anxiety one step at a time. So if I can give a very vague example, some people have agoraphobia, not specifically social anxiety. They don't, they haven't been out of the house for years. Then we say, start off very, very gradually. We call it graded exposure. So you might take some medication. You have short-term medication that doesn't sedate you, etc. And we just say, for example, open the door on the first day, and that's it. Second day, get into the car and don't drive. Second, and so forth. So that's how you can overcome it. But also, you need, as we said earlier, the antidepressants. It depends what kind of anxiety it is, and then psychology will be helpful, either in terms of the breathing exercises, anxiety management, but also to try and find out where the social anxiety originated from, and to try and change the person's thinking, because really what anxiety is an exaggeration of the risk of a situation. I know something bad's going to happen if I go out, or it's I can't cope with this, but actually you can cope with most things in life.
Okay. I've got tons of questions coming, but we can't deal with them, unfortunately, because we've got like 2 minutes to round up. Okay. So, Dr. Mullah, I want to thank you for joining me on the program this evening. Alhamdulillah, it's been extremely informative, and I want to apologize to all those listeners who have sent us, messages, sent us questions which we can't deal with, but I'm sure in future programs we will be in a position to deal with it. I'm just thinking I can maybe squeeze in a minute.
No problem.
I'll just squeeze in one more question. Okay.
Make it simple.
I hope it's simple. Okay. Okay. Assalamu alaikum. Doc, how safe is Brazapam? Taken half of 3 milligrams every second day. Jazakallah, my mother takes but not addicted to it. That's the one question. Another question, maybe you can just deal with very quickly, is what are the long-term effects of alprazolam?
Okay, so both of these
I'm giving you a minute for both.
Both of them are actually the same group of medication, which are benzodiazepines, which really, strictly speaking, should be used for anxiety, to calm you down during the day, not to be used long term. Having said that, we have 1 or 2 patients and they're quite old and they've been on the medication, low doses for years. We don't want to suddenly take them off the medication. So it's not ideal. It's not something which is a long term treatment, but it can be used short term, and the main thing to make sure is that you don't get addicted to it, because then you end up with another problem.
Jazakallah khair. A quick message for our listeners, Doc.
Shukran for listening to me. Once again, it's important to identify depression. You want to distinguish it from sadness. You want to distinguish anxiety from worry. You want to take full responsibility for what for things you need to change. But very often as well, you do need medication for the short term, but sometimes longer term as well.
Dr. Zubairullah, Jazakallah khair for joining the program this evening. And I would like to thank all the engineers for the various radio stations for having engineered this evening. And I want to thank the listeners for tuning into Medical Files. Medical Files will be back with you next Tuesday evening, inshallah, at 8 p.m. And before I leave you, I want to say to you, may you be in the care and protection of Allah subhanahu wa ta'ala. Until we chat again, from myself, Faisal MJ Sulaiman, do enjoy the rest of the week. And it's Assalamu alaikum wa rahmatullahi wa barakatuh.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
Bismillahirrahmanirrahim. ربنا فاغفر لنا ذنوبنا وكفر عنا